So what is implementation? There are many different definitions of implementation, but in short, it can be defined as a set of planned, intentional activities that aim to put into practice in the real world evidence-informed policies or practices. Implementation is a process. It's often described as an art as well as a science. Its aim is to benefit the end users of services, be they children or young people, or adults or communities. Implementation is about the how as well as the what. So implementation science is the study of implementation. And the evidence from implementation science tells us that we face the same challenges in implementing whatever sector we're working in, be it agriculture or forestry or health or education and training or children and young people. The field of implementation science builds on a significant body of knowledge that already exists in the worlds of management and change management, organisation development and policy development. So why does implementation matter? Implementation matters because even though there's been a large body of knowledge built up over recent years about what works in terms of human and social services, the outcomes for service users haven't improved in line with that growing knowledge. And this has become known as the implementation gap. The implementation gap is the difference between our knowledge of what works and the application of that knowledge in real-world settings. There's a significant body of evidence which exists now that suggests that planned, well-resourced implementation leads to improved outcomes for service users. So implementation is about bridging the gap between what we know works in terms of a policy or a programme and getting that policy or programme into real life. Sometimes we assume that service users and practitioners are going to absorb what we know from research and evidence and put it into practice in their services by osmosis or by magic. But in fact, we know that to apply the learning from research can take a number of years, and it always requires purposeful, planned activities.
What do we know about effective implementation? Implementation science is a relatively new discipline, and yet it is developing rapidly. Advances over the last 15 years have increased our understanding of the factors that may contribute to effective implementation. And there is an emerging body of research that defines the core components and processes involved in successful implementation. These core components include an enabling context, leadership, stakeholder buy-in and consultation, resources, staff capacity, implementation plan, communication, and finally evaluation. Researchers from across disciplines and sectors in human services have integrated these core components into a number of implementation frameworks which reflect best practice in guiding and supporting effective implementation in policies, programmes and services. Implementation stages. Implementation science research points to 4 stages of implementation. Stage 1, exploring and preparing, involves deciding what innovation you're going to implement. Stage 2, planning and resourcing, should involve activities which lay the foundation for effective implementation of the innovation. At stage 3, the innovation is implemented for the first time. Stage 4, the innovation is fully operational and integrated and is ready to be evaluated. Each stage of the process is essential and cannot be skipped. But implementation takes time, and full implementation takes between 2 and 4 years.